Welcome to Fill Up Your Toolbox Chiropractic Technique Seminars. I'm Dr. Paul Hunter, chiropractor. This adjustment is correcting for rotation of the pelvis around the long axis. I first did this adjustment in the 90s. I was adjusting a patient with a low back problem after doing push moves for PI-IN ilium and a pull move for an AS-EX ilium, and came to a point where I was at a loss as to what to do next. I knew the patient's pelvis wasn't corrected yet, and I looked at the configuration and visualized it in 3 dimensions. It was IN and EX. I wondered, what if I put my arm under the patient and corrected for IN, EX, holding the pelvis in that position? Well, it worked like a charm. And after doing this procedure many times after that, I didn't realize until sometime later that what I was actually doing was correcting the pelvis for an AS-EX ilium, a PI-IN ilium on the other side, and doing 4 directions all in one move. I'm going to demonstrate on the dry spine pelvic rotation around the long axis. We use a reference point of the posterior superior iliac spine, and that point is our reference point in which it can go anterior superior, posterior inferior, externally rotated, or internally rotated. For pelvic rotation around the long axis, we have one side that's gone AS and EX. The other side has gone PI and IN. Unless there's an anatomically short leg, we would assume that the side of the PI ilium is going to result in a short leg on that side. The ilia has gone PI and then AS on the other side. It's going to make the PI side shorter. So the correction is the dominant arm on the ilium on the PIN side, correcting for PI and IN. The other side correction is for AS and EX. We're going to use prone active leg extension to test for the patency of the low back and pelvis sacroiliac joints while assessing the active prone leg extension for one or both legs being restricted or weak. We can palpate for detecting IN and EX ilium. We can palpate to determine IN and EX ilium. We do that by having a light contact between the PSIS and sacrum. And when the patient extends their leg, we're feeling to see if one sacroiliac joint space is wider or narrower than the other. The IN ilium will feel tighter, narrower, and more snug with the PSIS to the sacrum. The EX ilium will be wider, open, and often there'll be some edema here with tenderness and discomfort on leg extension. Problems in the upper thoracic, a rib over here, a rib there, can make this weak, so you have to clear those areas before you can use the prone active leg extension as a test for the low back and pelvis. So we've done that. We've cleared ribs up here and lower thoracic. We've cleared a lumbar and adjusted the sacroiliac. We're left with one or both sides that are still showing weakness or restriction in leg extension. Patient's prone. We position the pelvis so that the crest of the ilia are at about the superior edge of the pelvic piece. The doctor's facing the table on the side of the AS-EX ilium. The hand position on the left side of the table for AS-EX left and PI-IN right. Doctor places his dominant arm under the pelvis at the level of the iliac crests. And then note, this is well above the symphysis pubis and of course well above the genital area. This hand is contacting the PI-IN ilium with fingers pointing medially, slightly caudally, and this hand is resting over the iliac notch with fingers pointed caudally and slightly medially. This is the hand position for the doctor being on the right side of the table. The right side now is facing the AS-EX ilium. Doctor's dominant arm goes under the pelvis, grasping the iliac crest. And the difference on this side is that now the hand position is over the iliac crest, but the fingers are now pointing cephalad. And we do this with a drop like that, 3 to 5 pounds of pressure. We'll do that 3 times. If we're successful, we'll see a noticeable increase in mobility, strength, and range of motion of the active prone leg extension. When you have the listings AS-EX, PI-IN, this procedure is a convenient way to seat the sacroiliac joints in an optimal position. Contraindications for this procedure are hernia, abdominal disease, an acute lumbar problem. You can use this on the pregnant patient, just don't use the drop piece. Even a late-term pregnancy, your arm that goes under the pelvis will fit nicely under the bump. This procedure, correcting for pelvic rotation around the long axis, has unique results. The doctor's hand placement, position of pelvis, use of the drop piece, and the fact that the pelvis is floating in a non-weight-bearing position allows an effective shearing force through the sacroiliac joints. The beveled surfaces of the sacroiliac joints and the line of drive through the joint plane line are amenable to correcting the Gonstead listings in 4 directions simultaneously. If you try this procedure and you find it effective, you can email me with your feedback at fillupyourtoolbox@gmail.com. You can read the full article about correcting pelvic rotation around the long axis at fillupyourtoolbox.ca/.com.